want to make sure that everybody that wants to speak at public comment signs up. Because if you're not signed up, you won't be speaking. Good. Okay. So I'll start with DAL.
Michael Allen, DA, voting member.
Archie Von Colorado Springs PD, voting member.
Jamie McConnell, proxy for Chief Royal, voting member.
Mark Christiani, Fountain Police, voting member.
Dr. Emily Russell Kinsley, El Paso County Coroner, voting member.
Denise House, City of Manitou Springs, voting member.
Bronski, Cindy non-voting member.
Michelle Wolf from Teller County Public Health, non-voting member.
Eric Cardell, proxy for sheriff level voting member. Good afternoon, everyone. Chief Dyson, Police Department, proxy, Cripple Creek.
Jake Marcus, Teller County Sheriff's Office, proxy for Under Sheriff. Stan Bishop, voting member.
Laura Nelson, El Paso County Commissioner, voting member. Harry Geithner, El Paso County Commissioner, voting member.
Kitty Hodges, El Paso County Attorney, Legal Advisor to the Council.
Amanda Grant, Fiscal Agent and Facilitator for the Council.
And Eric Scott, Teller County Commissioner, voting member and Vice Chair.
Lynette Criverson, City of Colorado Springs, City Council, voting member. Moving on to item 2, staff reports.
Yes, ma'am. So you guys all have your financial report printed out for you. I sent that at the meeting as well. The only real changes this month from last month are just the interest allocation and then the contracts and grants line under the operating expenditures. Those are all of the contracts and grants that you all awarded at the last meeting. And so those have been placed there to ensure that we have a true available for appropriations number. Again, that number is pretty high because we did elect to pull down all available funding out of the cost database. And so that is sitting in our account and available for appropriation over the next several years. Any questions on the financials?
But more will still be coming in.
Yes, ma'am. Okay, if there's no questions on the finances, I'll just move to the administrative updates. All of the grant agreements from last meeting have been prepared and signed, and the funding distribution is in process. The website has been fully integrated into the El Paso County site and off of the previous host site and has been completely updated with all of the information from the strategic plan and the new grant cycle information. And so that big migration is complete, and we'll just continue to update and refine it as necessary. Internally, staff have been evaluating the current ROAC meeting cadence, and I intend to bring forth a recommendation to you all to streamline our meetings and possibly look at the workload and decision-making needs of the council. Now that we've moved past the bigger hurdle of getting together a strategic plan and we're not reviewing presentations at every meeting, there might be an opportunity to move to a less frequent schedule. Our bylaws just say that we'll schedule meetings as necessary. They don't dictate monthly. That's just been what we've needed to kind of get this council off the ground and get things moving. And so you'll see later in my PowerPoint that I proposed July and December this year canceling. And then I intend to bring forth a recommendation for next year for a different cadence. We're also continuing to monitor the national opioid settlement litigation and additional settlement agreements as they're finalized, and we'll provide updates regarding any impacts that those have to our projections and allocations. We just got an allocation in 2 days ago that my staff are reviewing. So those numbers continue to change as these actually settle and they write the checks. We'll continue to keep you all updated on that. The Attorney General's Office and the COAC have announced the 2026 COAC conference that'll be held September 30th, 2026. It's a one-day conference this year. They've gone between 1 and 2 day, and this year it's 1 day. I believe it's in Keystone. Registration information will be available shortly, is what the website says. But as soon as they do send out that registration information, I'll send it to you all to see if anyone wants to attend. That registration and travel expenses are an appropriate use of ROAC funds for COAC's guidelines. And so if anyone on the council did want to attend to represent Region 16 and your own budget didn't allow it or you chose to, that is something that this funding could be utilized for. Yeah. So those are all of the administrative updates. Are there any questions?
All right, we'll move on to see the data working group updates.
Okay. So the data working group met on June 17th to review the strategic plan metrics. And I'll back up a second. The working group as in staff. We wanted to have the first meeting with just staff to kind of get our bearings and kind of see what are we looking at, what do we need to do, how are we going to organize this to better support the council. And so they met on the 17th to review the metrics related to all of our ROAC goals. Those members identified some challenges with existing data sources and some limited in data. And so they're working through the feasibility of some of our 5-year targets and what that looks like in finding the appropriate data sources to start locating that information so we can get a true baseline this first year. They also started evaluating some alternative or supplemental measures for outcomes other than what we currently receive. A lot of the information that we have right now is really incomplete. It's a lot of self-reported data and some EMS and ER data, but it's not a holistic picture at this point. And so they're talking through kind of those broader themes and how we can start identifying areas to pull that information in consistently. And then they began their work on standardizing our reporting templates for our funded partners to make sure we have good, consistent reporting information that aligns directly with our strategic plan as this new application process goes forward. And then they discuss some opportunities to strengthen data quality and interpretation through partnerships with additional stakeholders, including possibly the fire department, the coroner's office, and some other data systems users that they're in talks with. And so moving forward, the group intends to continue to meet monthly and mapping available data and bringing that information forward for ROAC.
Any questions?
Yes, ma'am.
What do you anticipate the timing will like to report to us and your finding out?
I anticipate after our next meeting, we'll have a better baseline and understanding of where the data subset group is actually going and what our targeted audience will be, what those reporting metrics will drive. I think we'll have a better understanding of what we're going to ask our subrecipients to report on and some of those standardized objective data measurements and make those a requirement for their reporting templates. And then I anticipate being able to bring some of that information back probably within about a quarter or so.
So I do have some, you'll see in the last slide I have for us today on next steps. I do have some time held in our September meeting to kind of do a deep dive and a strategic discussion on where we're at in that regional data and evaluation framework. And so that would be a good opportunity for us to give a first pass of like what the challenges are and where we see things headed.
Are you partnering, when you say staff, is that like someone from El Paso and Teller County Public Health also bringing to the table any data they're collecting, or what is this like?
So far, and correct me if I miss anyone, I know we've included Michelle Wolf from Teller County, our partners with El Paso County Public Health. Forgive me, I don't know his real name, Tiny.
James McLaughlin.
Thank you.
We know who you're talking about.
Because that is one of the things that the council has funded was some data collection tools, and Gelada, I believe, is the system. And so he's really excited to bring the information he has. And then I know Nick has intended to have some conversations with CSFD and the coroner's office and some other folks to see what information that we can share.
You've been warned.
I was wondering about the invite. I'm like, they're gonna tell me what this is.
I apologize. I will talk to you after the meeting.
That's great. It's no problem.
But that was actually at the advice of Tiny, because he said you all are already using Gelada and he's getting ramped up in that. And so he thought that there might be an opportunity to share some data systems and learn some information. So
Yeah, I think that's a great idea.
yeah. Yes. So we're doing, we're trying to pull in everyone that we think has kind of a piece of this scattered puzzle, because as you all know, I think across the state, data collection in this area is really difficult. It's bifurcated. It's not super congealed. It's not an easy thing to find. And so I think it'll be a work in progress, but.
Any questions on the data? Moving on to wastewater testing contract.
Yes. We have called from CEC Analytics is on the phone. Sure. Can you hear us, Paul?
Hi, good afternoon. Yes, I can. Thank you.
So this is a agenda item to discuss the current wastewater contract that we have and some of the reporting that we've been receiving. And can decide if there's anything that we need to change with what we're doing with this contract or yeah, anything that we deem that needs to be different in the reporting or something like that. And so Kenny, do you have anything to add before we jump into the conversation?
Not immediately. I have provided a memo of options to everyone via email, but I think that today is probably the best time to discuss with the contractor what the council's preference is on how it would look going forward. And then weigh options from there based on answers.
Okay, so we provided the reports that we received from CEC to the council, and I know Dr. Emily's office did some evaluation, and we went back and forth between the coroner's office as well as CEC to get some questions answered and get some information. So Emily, do you want to give kind of an overview of the questions that you all asked of the contractor and the information you've received and kind of where you see this data?
Sure. Actually, I brought
Great.
Andrea Tully, she's my chief toxicologist. Do you want to come up to the podium, Andrea? And so I gave it to her and her staff to look at. I started to look at it and I just found it, I found the reporting confusing. I was very excited about it and I found it confusing. So I handed it off to Andrea and she came up with this list of questions that you all saw with CEC responding in blue. And then Andrea wrote additional responses. I think it at the baseline, I don't find it useful. I don't find the information useful and I have concerns about the data. Our office has concerns about how the conclusions that are coming out of this. So
Yes.
if anyone has any more specific
Yeah,
questions for
well-
Andrea.
Andrea, if you want to, we'll ask you questions after, if you want to go ahead and present your presentation. Thank you.
Well, yeah, she didn't plan a presentation.
No.
She was here for.
She's here for questions.
Oh,
I'm sorry.
Provide us a general overview of your concerns with the data.
Sure. So some of the biggest concerns that I had was the reporting style didn't seem like it was thorough or proofread, if I can say that. It seems like there were a few errors that were pretty obvious, and a lot of the data that was provided was really, really confusing to especially people that might not look at data like this every single day. There were some inconsistencies with identifications of things that were even drugs. There were inconsistencies with how things were being classified, which led to an incorrect reporting of the concern value. And there was just, I'm a little curious about the methodology that's being used and the validation that went into using that methodology for these analyses.
One of the things that Andrea, pointed out in her questions is that, there's a drug that, that is not used clinically. It's not used in a veterinary setting. And, for any of our knowledge, including people who study this across the United States, it's not used as an illicit drug. And yet the report says that it's found more times than drugs that are actually frequently prescribed and people are using. And so I think that really makes me concerned about the utility of this.
For the record, what is that called?
Palazepam.
What is that used for if it's none of the things you mentioned?
It's not used here. It's not used clinically. It's not used
Veterinary.
in veterinary medicine. It's not even illicitly. here.
It's an
So
SSR,
We've never seen it
not, it's rarely.
Interesting.
in all of our testing that
And
we,
they're showing a significant reading in the water.
much more than drugs that people are actually prescribed and used frequently, commonly.
So, my first question on this goes back to why, and why are we having this contract with this wastewater testing company? And I know we've said it's to understand what drugs are in our communities, but I still feel that we can understand what drugs are in our communities better than this. And then the second question I have is, so if the data was actually accurate, what are we going to do with that data, and how are we going to use it in this council? But then I did have a chance to read the report, and it looks like there's a lot of questions that were answered, or questions that were being asked. And quite frankly, my biggest one that I had an issue with was number 8. When we're looking at the response, because I think you asked specifically, is this an AI generated query?
Yeah.
And the response is no, they're using SQLs, but the response back was, it seems like it's still a lot of AI based. And it sounds like this is still a learning process, and maybe it is a learning process from them, but it's not validated by the work of experienced analytics, and there's many egregious errors that are being reported. That's a very big concern, in my opinion.
Yeah, I noticed a lot of errors with classification of drugs, identifying what is a drug versus something that's not a drug. And essentially just the review of the results. You know, when I took the time to review some of these drugs and, you know, kind of figure out, well, what exactly are these frequently seen drugs, and why, you know, why are we seeing them? It just made less sense to me. A lot of the drugs that they were seeing are drugs that have been discontinued and taken off the market, withdrawn completely, like in the 90s. And they're not used in any other way. They're not being used in a novel psychoactive substance way, or any veterinarily, they're not being used. And as Dr. Russell Kinsley mentioned, with, you know, drugs that are commonly prescribed, for example, the Flazepam metabolizes to more diazepam, which is an active metabolite of other commonly prescribed benzodiazepines, such as Valium, diazepam, chlordiazepoxide, which is frequently prescribed for ethanol withdrawal and, you know, convulsions with that. And only 1% of clozapam is excreted as unchanged drug. So to see an overabundance of this particular drug, more than its active metabolite, which is what we'd expect in wastewater, it just doesn't make any sense, and it doesn't seem like it was researched as to what is this and why are we seeing it? How does this make sense in the current landscape of drug use in the United States? So those were a lot of my big concerns.
Commissioner Nelson.
I was going to bring that up, the comments that you made about the halazepam should be metabolizing and the evidence being seen in a different compound. I'm not going to try and pronounce all of these, but that you're seeing that higher rate of halazepam. And so it just calls into question, is this data sound? And, you know, we maybe don't like some of how the information is displayed, and that's something you can give feedback on and ask for corrections, which you had to, which is also a little disappointing to see that some of the labeling wasn't really well done, which I have really high expectations for scientists to follow through and help make sure they're clearly labeling. But when there was enough in this report that made me concerned that can we trust this data source? And I don't know that it means we don't continue to pursue monitoring wastewater. It's maybe we need to look at going out for RFP again, because is there a way for us to still get an understanding of the prevalence of opioids in our community? And this is just one more tool in the toolbox compared to like emergency room visits and that sort of thing. I think that's a conversation we can have, but I am concerned about what I read in this report around, can we really trust this information? So thank you for bringing it to our attention.
Yeah.
Because, you know, I don't have that kind of a science background. I have a different science background. And so this isn't something that, you know, most of this council would have been able to realize without your support.
Well, and to Commander Chacon's point, we do UAs in PD. We do UAs on that. We do UAs in the ER. We know from wherever, whether you're going to the emergency room or you're being arrested or you're doing a, you know, or mat rescue or whatever we are doing UAs. So, or blood draws, mostly UAs, but we kind of have an idea. And in the coroner's office, you can extrapolate that from what you do. I'm going into detail, but we do have a lot of people gathering that data. I think the question is, how do we gather all that data into one source? Maybe better and highest use of.
Yeah, so I just want to kind of separate a couple of things, because there are programs, and I did some quick research, and I would recommend that maybe we dive into it a bit more. There are cities and communities in the United States who have been doing this, one since 2017, and have found a way to use this data very usefully. So I think there's two things in my mind. One is, are there red flags that this particular company has reliability concerns? And I think the answer is yes on that. But I also think there's the other thing about, it's not just about what drugs are in our community. I think my interest is in how do we track trends? And it's not down to the, you know, super detailed level of all the different drugs in our community, but it's a trend line of how many opioids are being metabolized, period, by the population. Can we see a trend line that things are going up? Can we see a trend line that things are going down? And so, for example, like North Carolina, there's a city that's been doing this and they use a different company. You could even reach out to them and ask them, you know, what do they think after doing this for almost 10 years? But at least what they say is they've been able to reduce opioids, not just with this, but it's part of the tool that informs decision-making by overdoses by 40%. So like, how are communities using this and how are they using that trend line? Because we know you're not going to catch everyone. You don't know the denominator in the emergency room. You don't know the denominator of, you know, how many people you're catching out on the street. You know what you catch, but you just don't know like how prevalent this truly is. So that's what I'm looking at as a trend line. So rather than even it being about which all the different things are, like if we even want to just focus on opioids of a trend line, is it going up? Is it going down? I will say I do have concerns because of CSUs not wanting to participate. So I do think that is a really big question for us. And so whether it continues to be valuable, but I can also see a scenario, and I've kind of mentioned this before, where if we're collecting on a trend line, we're seeing where we're at. And even if it is in Fountain, even if it is in another smaller jurisdiction, and we can target a campaign through one of the agencies that we've been using about, warnings about different types of drugs or whatever, and we can monitor that trend line. We can say, hey, this campaign has been going on for the last 3-4 months, and we actually are seeing a change in the trend line. Now, that's a correlation, not a causation, and we know there's a lot of factors, but I think that's what I'm looking for, is how do we verify with some sort of objective measure We know that self-reporting is unreliable, but maybe we use self-reporting and we get on a good schedule of that with the ER visits, with these other things, and we can put it together and really see a full picture of data for our community. That's my interest, but I do think this is there are red flags here about the reliability, but I look at programs that have been going on for a long time, and I think that we potentially could reach out to those communities and ask how they're using it, the company that they're using. I think Tempe, Arizona actually uses the university itself to do a lot of the work. So I just think that, there's maybe an opportunity to still continue to use the objective data that can be, but maybe we work with some other locations around the country who've been doing this for a long time and get some better ideas on who can perform the work reliably.
Yeah, just keeping in mind that regardless of who we use, CSU is gonna opt out. That's just a big chunk.
Yeah,
To your
and that's,
point,
I said,
we're
that
not
is a
gonna
big
get
piece.
that
So
clear
that is a
picture.
question is like, when I think about, if we could do it in Fountain and try something, maybe it's even a pilot, and you can geofence specific areas, specific neighborhoods for, high level contact on digital, advertising and those type of things. So even if it could be, hey, we're gonna try this program here, we can see it's doing things here, maybe we can extrapolate from that it's still a good idea to move forward with Colorado Springs.
Chief, did you have a question?
Yeah, a quick comment. These two ladies have summarized it, but without kind of taking the discussion a different way. I wouldn't allow for it because I don't like numbers. What have you been in
I just hit 12 years this week.
Ma'am, how long have you been?
14.
Okay. The red flags, be it as they are, my biggest red flag is they don't get it. If I don't get it, I rely on them. Help steal. My biggest red flag is they don't. And I don't know if now is a time perhaps to hear some answers. And may help frame for questions as we move along, but we've thrown a lot of stuff out there. I don't think it's proper to hear some responses and then we can kind of.
Denise?
Yeah, a couple of things. I agree with you, Commissioner Geithner, that we need to have a bigger discussion. And I would ask that to be on the agenda at the next meeting to really discuss the why and what we do and how we move forward. But today, the agenda is about this contract. And I'd like to have CEC respond and be able to hear that one. I want to thank staff for what you've done. And this is, as I think we've all said, lots of detail and things that we don't understand, but I'd like to hear their response. And then I think I'm ready to make a motion at that point, depending on the response.
No, I was just gonna add to what the chief said is, obviously there's red flags that they've identified, but not only red flags, there's issues with the data that seems like it's not, that is just not accurate. And that's the biggest thing. That's my concern with this company.
Okay, Paul, would you like to make some comments or respond to some of the discussions and questions you've heard?
Yes, and thank you for your time today. Thank you for having the ability to do a Teams call. So I think I would like to begin by just stating that this is the first time that we have received feedback on reporting. And I think that's really important because I think there is a lot of data that we have generated from each of the participating sites. And there's a lot of ways of actually reporting this data. And we want to make sure that it's useful. We want to make sure that it is digestible. This is a novel way of monitoring drugs in communities. This is not something new. This is something that we've been doing for quite some time. So we would like to have the opportunity to refine our reporting just to make sure that it is useful. We want to make sure that it is useful, is actionable. And there are two big things that I wanted to address. We do two different types of techniques. We do targeted and we also do not targeted. And the questions that have been raised in the responses as well as our discussion today has really been focused on the non-targeted analysis. On the targeted analysis, we use surrogate deuterated compounds just to make sure that we are able to quantify these targeted compounds in a very complex wastewater matrix. We have calibration standards for each one of these compounds to quantify with high resolution and high sensitivity. During the start of this program, we started off with 32 drug targets. This included both the parent and metabolite compounds that range from a wide array of classifications or drug classes like benzodiazepines, opioids, drug poisoning agents, etc. What we have done since the beginning of this program is we have actually increased to 65 compounds. And that includes new emerging synthetic opioids that are found in drugs that are related to increased overdoses. So we have increased our drug targets by double. In doing that, we've also increased our sensitivity of our compounds, again, using deuterated compounds that are standard right across laboratories in Canada, internationally, and the United States. So for the targeted analysis, we have extraordinarily high confidence in our ability to detect and quantify and trend. A lot of the red flags that have been spoken today relate to the non-target analysis. And the non-target analysis allows us to have an open scan, high-res mass spectrometry of polar compounds. And we are able to see compounds that are both in parent and metabolite. And it is our job to really classify these compounds, and that we use library sets to classify these compounds. There are challenges with this that we have been very open about. And one particular challenge has been highlighted by halazepam. When we took a closer look into halazepam, it has the same monoisotopic mass structure or mass as a very commonly prescribed antifungal pharmaceutical. And that was of interest to me because that was a very good point that was brought up. It was a concern of ours as well that we have seen this diazepam that was not on the market, and we did a closer look and we did find that this could be with high confidence an antifungal pharmaceutical. But again, we wanted to highlight this because we are having the ability to look at not only illicit drugs, but pharmaceuticals that are often abused as well, such as gabapentin. In our monitoring and in our weekly samples, we were able to detect medetomidine. We were able to detect it in increased rates, and I believe it was, I'm just pulling this up now, it was in Cripple Creek that we had the highest increase. So we do see incredible value with this data. I think it is important that we consider how this is reported, both in terms of both targeted and non-targeted. We are seeing tens of thousands of compounds across this particular project. And I think, I will take this back to the team. We are able to look at the data from the NTA perspective even more closely. So that's something that we can do to improve. If this goes out for RFP in this contract, the companies that will likely be responding, we actually do perform analysis services for both the targeted and the non-targeted. So one way or another, there will be that relationship because there's not that many people or companies out there that are able to do this. So I think overall, we like to have the ability to reflect on these comments, look at the data, perhaps schedule another time where I can present our findings even more and provide options for continuing forward. So thank you.
One of the concerns was that there were, and the response was, after further review, we identified 40 compounds that should not have been on the illicit drugs list. Those are now removed. So when you say you've been doing this for years, how do we balance the fact that you're identifying drugs as illicit and then that's inaccurate? And
Yeah,
it's
so-
what we're hearing or what we're perceiving is in our community.
Yeah, so that is a good point, and it's something that we have looked into even further. In order to provide classification of compounds using a non-targeted approach, and I think this is important because that is, again, that type of analysis. We've curated compounds on our targeted list that is in response of substance use physicians, mental health physicians, toxicologists, sheriff departments, etc. But so for the non-target analysis, when we identify a compound or a signal, we label that signal as a compound, and that is based off our library sets that we have available. We have curated a number of different library sets, and we have, looked through these library sets. These library sets have labeled these compounds as illicit. I think this is something that we need to review even more closely. So that's where the labeling comes from, is these library sets that we've curated. That again, but this is for non-target analysis, not for targeted. But again, it's something that we can reflect on and go back and address.
Denise, did you say that you had more comments after?
Not yet.
This is a time for this in general.
Yes.
This discussion, I think, is now centering upon consuming. There seems to be a lack of it. And if the corporation of this company now is saying that they have their hand in testing of all of these other companies that do this, I'm going right back to the issues that we dealt with facilitators. And what was the expectation? What was the problem? What did we get for the money? Who would help us? More importantly, I help them. And I don't know that. It's funny, you and I are looking at the exact same page. I mean, I can understand to some degree that there's going to be things missed. I get it, right? We all understand that, but we also have a level of expectation from the contractors that we employ to give us meaningful data without it looking like a rubber stamp document with the header changed. Specifically, the one you're speaking of is in one of our water plants, which that's interesting because now I'm looking for things that aren't even there. Maybe I'm being nitpicky. Maybe I'm not. Maybe I'm saying what people are thinking. I don't know, but when I have this much QC issue, I think that's just wrong. Thank you for the time.
Yeah, mine goes back to a comment on a response by them. I'm sorry.
Oh, go ahead.
No, I was just gonna say my actual question comes back to a comment on the report by them. And it basically is a comment of where's the human element in the testing? And is there even one? And that's a question for the analytics company. They're still on or are they off?
He's still on.
So just so that I heard that correctly, the question really is there a human element to the analysis? Is that correct?
Yeah, because when I keep looking at this report, it seems like it's more, quite frankly, AI generated, and there's a lot of questions that are coming up of where is the human element present in testing of these samples? Am I mistaken?
It's definitely more so in like reviewing the data that's being generated by these instruments. They generate a bunch of things and there is a library program that will give you best matches and best guesses to things, but it really takes that human eye to look at the matches that you're obtaining with the data that you've obtained and determine, how close is this match? How accurate is this? How believable is it? Because, it could be something totally different.
Jake,
I also think when you put together a report, you have a duty to make it useful and honest and to look at this stuff before you publish the report. And I think that's really disappointing to me in these reports.
I guess I pose a more of a question specific to the company as far as pharmaceutical training and how it's involved in that. Because anybody can pick up a phone and type in pill identifier. We do it all the time on the road. And type in what a stamp is on a pill to find out exactly what that pill is. We don't know what the heck it is, but we can identify it based off of that information. And then we have a presumption at that point. We have to send it off to a lab to say, yes, this is absolutely what this is, 100%. So my concern is what is the pharmaceutical training that is involved in that? And is there anybody that's actually pharmaceutical qualified in order to identify those compounds that we're questioning?
Yeah, and so I guess going back to the first question, I was looking for CEC and listening to Jake and you, it goes back to, so is there somebody that looks at this before the report is published? And if so, are they qualified to look at this report before it's published?
Yeah, so I can certainly answer that. So I will walk through the process of which once we receive the sample and then once we do the reporting. So I can start there. Samples are collected by wastewater operators at each one of these facilities. Samples are then sent to the office or laboratory here at CEC's. We accept the samples. We do a split sample. Samples are tracked using a chain of custody, so we know exactly who is in control of each step. So that's human element number one. Human element number two is when we actually handle the sample and do sample preparation in order to prepare the sample for sample injection. There are two instruments that we use in order for looking at these polar organic compounds. The first instrument that we use is an ambient ionization mass spectrometry. And it applies a direct ionization to the compound in order to see it in the mass spec. So in order to see that, human element number three is the qualified chemist that is able to create the method for identification and also quantification. The fourth human element for the target analysis is looking at the results. And that is able to check and quantify, is the calibration curve correct? Is this compound there? Yes or no? How accurate is it based off the surrogate standard? And we have this all tracked. We have this all recorded. We have all this documented for all 65 compounds. And then we bring that onto our reporting dashboard, and that goes into our targeted analysis and our results. I think, again, the questions in terms of the credibility and the analysis and the red flags that have occurred is with the non-target analysis. So the human elements to that, again, is receiving the sample prep, and putting that into a machine that has methods developed. We generate raw data from an instrument called the liquid chromatography quantitative time of flight, which is a quadrupole MSMS. It's a very standard equipment, but we generate a raw data file. That raw data file is then processed through mass spectrometry data softwares that will do a peak identification and then quantifying it, matching it against libraries. So we have a high degree of confidence that yes, in fact, it's there, or we have a lower confidence, and we have different tiers of mass spec. So there is a person, again, a chemist here in staff, has a PhD in mass spectrometry. He has 3 postdocs, one from Texas as well. He has designed and developed methods for tracking pharmaceuticals for a number of years. I do a final review as well as the reporting here, and we issue the report to the council. Again, this is the first time that these questions have been raised based on the reports, and it's something that we can address.
Yes.
Speaking to the targeted analysis, when it was questioned, the responses with a, intensity of 0. And you responded that those compounds were detected in the sample, but they're below quantifiable limits. So is 0 your limit of quantitation, or what is your limit of detection? Like, I have a hard time understanding what a peak of 0 intensity means and looks like, even with your explanation.
Sure. So our limit of quantification has improved within the last month just because of we've added more compounds to the methods. So our lowest limit of quantification is now 5 parts per trillion. So that's nanograms per liter. It is the lowest on the market. Some compounds have higher limit quantifications. I think that an area of which we can improve is perhaps not say it's 0, but it's actually below limit quantification. So it's below 5 for that particular compound. It is detected, but just not quantifiable. Do I think it still should be reported as detected? Yes, I do think so, because we can actually see a rise in detection. We did not want to provide a concentration, even though it's detected, because it has a low confidence value of that actual concentration to be trended.
If it's okay, I'd like to make a motion. Sure. I move to terminate our contract with CEC Analytics Ltd under section 5A1 of the contract and direct staff to provide 30 days written notice of termination as soon as feasible.
I second.
All in favor?
Aye.
Any opposed? Motion moved. Thank you. Moving on to item 4, grantee reporting. We will start with Homeward Pikes Peak.
Hey, everybody. Sent in a presentation. I don't know if it's gonna. Yep. Okay, I'm gonna get it just a second. How's everybody doing today? That's perfect.
Yep.
Thank you. Yesterday at a board meeting, we were sitting there and the hailstorm started and everyone was on pins and needles, and I saw an alert today. I was like, gosh, are we gonna be on pins and needles again this afternoon?
If it starts hailing, we're out of here. So you know.
I suggest you don't run outside in the hail.
Might help. Sorry, go ahead.
That's okay. First of all, I'd like to thank you for 2 years of funding for 5 programs of Homeward Pikes Peak. It's been valuable to serving the clients that we have impacted over these last 2 years. Approximately, this council has impacted probably 2,000 people through street outreach, sober living, and outpatient treatment clinical services. And if we could move to the next slide. This was what we proposed to you in our year 2, that this grant would support our street outreach program with a goal of serving up to 50 unique people every month, every week. And we are meeting that goal. I'll show you on these next slides. Sorry, I'm getting ahead of myself. We also proposed serving single men at our Harbor House program, which is the oldest continuously operating sober living program in El Paso County. We have the Project Detour program for single women and the Bloom House recovery home for pregnant and parenting women. And finally, our outpatient treatment clinical program. So we can move on to the next slide. I want to break it down on what have we accomplished over the 11 months of this funding cycle for you. So far, this year, we have engaged an average of 104 people every month with providing deep case management to 32 clients. We're averaging moving 4 people into housing placements per month. That does not count the numbers of people that we are assisting getting into the Springs Rescue Mission Emergency Shelter. Last year alone, this program served 890 clients. So the whole calendar year of 2025. And of that, 83 were moved into permanent or temporary or permanent housing through sober living, supportive housing, independent living, or reunified with family out of this community. that's one of the things we've been able to use private dollars for, is to help verify and reunite individuals to family in other parts of the state and nation. In the little gray box at the bottom are the measures that you've asked, the ROAC Council has asked our organization to track, and that we're going to provide quarterly updates for. And we've created our own little slang there by putting letters that could connect to clinic or sober living or street outreach. I tried to make it intuitive so that you could see how we are interpreting the measures that you've asked us to track. So we are doing that by in every program. Moving on, I want to share a success story that illustrates the people behind the work. So this is a gentleman named Mike who was homeless in the Nob Hill area of our city for over 10 years. And through work with our team, we were able to complete getting government issued ID, help him get his mental health assessment, and move him into supportive housing. That took over a year. It is kind of challenging and frustrating that sometimes it can take that long. And some of those systems are the time it takes to track down a birth certificate from another state, the time it takes to work with an individual to do their paperwork when they have mental illness, the time it takes to get them into a treatment provider to get an assessment, and then working with the local provider, in this case, Greshio Housing, they had to remediate an apartment before this gentleman could move in, and then we had to move in. All of that time, we were supporting this individual. He was using community resources in the shelter and our team. This represents dozens of people that we work with consistently every month. Moving on. The Harbor House Sober Living for Men. In the last year, the program served 40 men. The median length of time was 5 months. 75% of those exited to different kinds of housing options. Some moved out into independent apartments that they're renting themselves. Some moved into shared housing or family, and some moved into supportive housing because after they were in a sober living program, a disability was identified and they moved into another structured housing opportunity for them. 75% of all graduates elevated their income to sustain independent living. And this is an important factor that Homeward Pikes Peak is working with each client to engage in education and training to get a self-sustaining wage. It takes many forms. Many of our clients enter the service industry. That's restaurants, groceries, convenience stores. We don't have very many who enter skilled trade, but we are trying to help those who can move up the economic ladder. Moving on, 2 years ago in 2024, we opened the Harbor House to serve fathers because this building is uniquely situated to do that. It's small 2-bedroom apartments. So ever since we've done that, we have kept 2 apartments full, serving fathers in recovery. We have learned a lot from this program and our other Bloom program, but I'll tell you about some exciting news later in the presentation. This is just an example of what can happen. There are not very many sober living homes that serve fathers in recovery. There was a demand for this, and so we changed our program model to respond to the need. And we have families like this that are now thriving and working to reunify families in our community. Moving on, the Project Detour Sober Living Program has been operating for 7 years. In this last year, we worked with 13 women. 69% exited to different housing options. Most of the referrals are coming from the DOC in our El Paso County Jail for this program. 69% graduated with self-sustaining housing wage. So again, working on helping these women take care of their needs and reunify with their families. Many of these women have children in foster care and out-of-home placement. So this house is solely for the single women. And then we help them discharge out to new housing options where they can live with their children. Moving on. Here's an example of one of our clients. It's really great when we see women building assets. So not only getting a job and repairing debt, but able to buy a car that helps them access employment and have that independence and then moving forward. So here's just another example of client success for you. Moving on to the Bloom House. This program has been running for 3 years. In this last year, we served 17 women and 9 babies or toddlers. Often, we are receiving women who are pregnant from community referrals. One of our biggest challenges is, this is something those connected to the El Paso County know, is that the CCAP program has received a lot of challenges with federal freezes and shortages and able to fully fund the program. So the lack of childcare for some of our clients has really paused our ability to help some clients access childcare so they can sustain employment. If you have an open case with child welfare, you generally can get into a CCAP slot. But if you don't have an open case with child welfare and you're just a TANF recipient, you may not be able to get childcare assistance. So this is one of our challenges with our mothers right now that we're trying to work through. This past year, we've had 5 graduations. We are maintaining 7 women in the house at all times, and we've had a 70% income increase. We're challenged here with some of these women because some go in and out of the workforce when their childcare situations fall apart. So that's a challenge that we're working with some of these moms. Moving on, I have a success story.
Can I, Beth, I appreciate, because we all are frustrated about the CCAP thing, but I do want to clarify, it's not a federal freeze. The Biden administration changed the rules in our state, therefore changed the laws. And as a result, the provider reimbursement rate went up, and yet the state decided not to provide any more funding. So the reason we are on a freeze is because the state has not provided enough funding for us to continue with the elevated rates. So I just wanted to make sure, for whatever reason, it's still a freeze and it's still impacting those families. But if anyone is interested in getting involved on that effort, it is a state choice to not continue to fund that program at the appropriate level.
Thank you, Commissioner.
Sure.
This is Samantha, who recently moved out this spring and was able to, through the program, she had a baby. She was able to reunify with the second child and move out recently. She does have childcare and she is currently employed and doing very well. The power of working with families has been really wonderful to see and heartening in our community. Moving on to the outpatient treatment. Last year, we served 117 clients through long-term behavioral health and substance use addictions treatment through our clinic. We did some data analysis recently for another grant application, and I wanted to share some of the information we gathered. So in the first 5 months of the year, we served 50 clients. 25% report opioid as the primary drug of choice. We've also found that many of our referrals from DOC report a higher use of amphetamines rather than opioids. That's just kind of a trend we're seeing right now. 70% of these clients are continuing treatment after the initial assessment. We think that's a really good uptick rate when there's a referral that's made because of a system wants you to participate in treatment. 70% engagement rate after that forced referral is a really good percentage rate. 56% of the clients report a co-occurring illness. So they have a mental health diagnosis and they are using drugs at the same time. 49% of these are also participating in one of our housing programs, whether that's sober living or permanent supportive housing, of which we also offer. 25% of our clients are showing a positive housing status change. So we look at that as a really positive outcome because either they are graduating from one of our programs and they're still maintaining treatment, or they're moving to another style of housing and they're still maintaining treatment. So all of those are indicators of stability and success. Moving on, we have a client success story for you here. This is Janice. And I think one of the things that we really wanted to show is that rarely is an addiction a solo issue. It's really frequently tied with a mental health issue. And one of the unique things about Homeward Pikes Peak is this continuum of services that we're offering, where we have supportive housing and our own outpatient treatment clinic. So we have these warm handoffs inside the organization that increases retention and services at both sides, the housing and the clinical services side. Finally, I wanted to share with you just some observations and trends that, that we're, seeing right now. When we started, Harbor House, as I mentioned, we were the oldest secular, longest running sober living home in the community. When I was on the CAR website, which is the Colorado Association of Recovery Residences, there's easily over 50 sober living homes in our community right now. So there's been a huge proliferation. I'd say in the last year alone, it's probably doubled. And that's an interesting trend because there's money to be made in this business if you're seeking to make money off of this movement. Homeward Pikes Peak is a nonprofit organization. We do not bill Medicaid for services inside these homes. We're using grant funding to support the housing in buildings that we own. And we're connecting clients to licensed substance abuse treatment through our clinic or other treatment providers. There's been a lot of news recently about some of the Medicaid billing for services in sober living and home health and peer recovery organizations. And I just wanted to point out that Homeward Pikes Peak is not a part of that process that's in the media right now. And it's concerning behavior. Our outreach team are encountering individuals on the streets who they're asking my outreach workers, well, do you have an incentive for me to talk to you? And it's like, no, we're here to provide you networking, provide you with resources, but our incentive might be a bottle of water to talk to you, but we're not giving you a gift card to talk with us and participate in a resource and referral or a housing survey activity. So there's a lot of concerning behaviors that are happening, not only here in El Paso County, it's definitely a statewide issue. I've already mentioned the strong program design that helps support our clients. And I brought a little show and tell. This is an IVAC. This is a breathalyzer that we use with all of our clients in sober living. So what this is a client will have an app on their phone and it pings them at random times during a 7-day treatment window. And it asks them to utilize the breathalyzer. It sends the result to the app and then it's uploaded to a data repository that we check. And this is just one of the ways that we ensure program compliance along with the random drug tests and the on-site staff at our 3 different locations. So we're really trying to work with innovative and interesting ways to help our clients stay compliant to a program that they've voluntarily chosen to join. I think one of the challenges that our street outreach team is currently seeing. Yes, Lynette.
Oh, you just gave me the 12-minute marker of your 2 minutes.
Okay, one last statement. One of the challenges we're seeing is appropriate referral for severe mentally ill individuals experiencing homelessness in our community. So this is a conversation that we're having with our CSPD officers, especially in downtown Colorado Springs. We are trying to bring partners together to talk about how do we serve individuals with severe mental illness who are living outside. And it is a challenge larger than this group and larger than Homeward Pikes Peak, where we're trying to bring partners together to discuss that. Thank you.
Thank you. Next, we have Hope COS.
Good afternoon. I'm Andrew Cooper. I'm a board member for OCOS. I've been involved with the organization since its founding. Obviously, I'm a fire department personnel as well. I'm one of Jamie's officers. I was originally involved with the founder of OCOS when she was working the community and public health division in the fire department. This is probably 5-6 years ago now. I was a lieutenant in that division and worked with them very closely. And ever since then, I've kind of attached to them in a way because I'm very proud about the work that they've done. So you guys have provided us some monies and my job is to come out and tell you what we did with it. So that's what I'm going to do. So Hope COS, we've been invited since the funding that you've given us, we've been able to go out and do peer connections and coaching in a couple of different places. First of all, we're at Westside Cares right now. So in person, we're able to make contact with individuals. The emergency warming shelter is what we're most known for. And then on the trail system itself, just like Homeward Pikes Peak, out there doing the work on a daily basis. Outside of those three individual places, we also have a new program called JBBS program, which is the Jail-Based Behavioral Health Services. And that is in conjunction with CJC. And what happens there is individuals within CJC are given our contact information. So far, we've had about a little over 800 individuals reach back out to us about peer counseling and recovery services, made some connections there. Of those 800 individuals, 124 upon release have been connected to our organization. We've gotten them on a regular connection and a personal relationship with those individuals, working with them. And then of those 124 that you had there, 24 is actually, we moved over into some of our own internal recovery residences and work release programs. During that time, obviously, we had program interventions, peer coaching, substance use disorder accountability that we've been working with those individuals on a regular basis. Great participation from throughout the community. And I brought Carrie with me today. She's going to talk a little bit about one of those examples, kind of like I speak did about some of the successes that we had. So she wants to talk a little bit about Angelo and then back in.
I'm very nervous to get my, so if I stutter, I apologize. Good afternoon. My name is Carrie Matthews. I'm a Colorado Peer and Family Specialist and a peer navigator with OCOS. For the record, Angelo has given me permission to use his name and his story, if you guys see. Angelo was referred to him through JBBS on December 23rd, 2025, while he was incarcerated in CJC. During his incarceration, he actively engaged in recovery workbooks, developed clear short-term and long-term goals, worked collaboratively on a sober living application and housing pre-screen. Through the coordinated advocacy involving OCOS, the housing team, myself as his peer recovery coach, and his attorney, Angelo was granted a supervised PR bond where he was released directly to me and entered OCOS recovery housing on January 21st of 2026. Upon entering the program, he was facing significant legal challenges and the possibility of a substantial criminal sentence. Despite these obstacles, he fully engaged in the Road to Hope program and quickly established structure, routine, and stability. Within 6 weeks of entering Hope COS recovery housing, Angelo became gainfully employed and soon secured a second job, demonstrating a strong commitment to financial stability and personal responsibility. He also purchased himself a vehicle, allowing him to obtain independent transportation and further increase his self-sufficiency. Throughout his participation, Angelo worked diligently to strengthen all areas of his life. He was granted visitation with his daughter and continues working towards family reunification. He successfully reunited with his significant other, who is also now engaged in recovery, and together they're building a healthier and more stable future. He demonstrated accountability, consistency, leadership within the recovery housing program, earning a promotion as assistant house lead and becoming a trusted mentor to other residents before later stepping down to focus on his other personal priorities. A significant component of Angelo's success has been his commitment to building recovery capital. Together, we have worked through setting and accomplishing SMART goals, the dimensions of wellness, the 4 pillars of recovery, helping him identify strengths, address barriers, and create a balanced foundation for long-term success. Through this process, Angelo has expanded his recovery capital across multiple domains, including his housing, his employment, his family relationships, transportation, community support, and personal wellness. He successfully completed the Road to Hope program while maintaining the housing stability. The legal outcome he is now facing represents a significant improvement from the circumstances that brought him into the program. On June 25th, 2026, Angelo celebrated 6 months of sustained recovery. Most notably, nearly every goal that he set for himself since he became involved with Hope COS, he has accomplished. And this is minus having his daughter back, Colby. But every goal that he set while he was still in CJC, he has accomplished and he's surpassed. And lastly, I would like to emphasize that we take great pride in providing ethical, person-centered, and high-quality services. My role as a peer coach navigator is not to direct an individual's recovery journey, but rather walk alongside them as they build self-efficacy, identify their strengths, and discover a pathway to recovery that is meaningful and sustainable to them. While I've had the privilege of supporting Angelo through advocacy, shared lived experience, connecting him with resources, providing tools to strengthen his recovery capital, and the accomplishments highlighted today are ultimately the result of Angelo's own hard work, determination, and commitment to change. His success belongs to him.
Okay, great. So the work like that with Angelo is similar to what we've been trying to expand upon. And since that time, we've been invited to provide services to all of the fourth judicial district courts and problem-solving courts. We've been asked to come out and speak at the DV court graduation to connect with some other individuals within the community. I think that the work that Hope COS is doing is really due to the people, and the people are because of the funding, right? We're able to get good quality people. I just want to make note of some of the individuals that are with us today. Hope COS, could you raise your hand? Real quickly, could you just say what your name is and what you do with the organization?
My name is Jesse. I'm the Community Engagement Responsibility.
I'm Jessica and I'm the housing coordinator for Hope COS.
I'm Danny Picado. I'm the CPFS Certified Peer Recovery Coach and Justice Program Coordinator. I'm Trey Stone. I'm a man in long-term recovery, proud of peer and family specialist and a peer supervisor of Hope COS.
I'm Carrie, I'm peer coach navigator, and I'm also CPFS certified.
Great, thank you for that. I think it's important to kind of bring their faces out to us because when we see funding all the time, we know that the dollars are going out the door. We don't really know what's happening with them. And I think it's important to put faces to titles and then the titles to what they do on a regular basis and the outcomes that we get from that. So I just want to thank all of them for coming out and do. Recognize that we're going to try to continue to do that. We also have entered into an MOU recently with Colorado Springs Police Department, and that's moved forward and that's been signed. Obviously, we have a close connection with Colorado Springs Fire Department, and their Community and Public Health Division, which is kind of the full connection now for the first responder side for the city. And I just want to thank all of you for your time. What you've done for us. Any questions for anybody?
Thank you.
Thank you. Appreciate you.
Next up, we have the Phoenix.
We're comfortable coaching workouts, and doing this kind of thing, so I'm just gonna take a moment.
We're not doing push-ups.
Visualize all the workouts.
Okay, fine.
All right. So, sorry, my name is Todd Jones. I'm this senior manager of strategic initiatives. I oversee nationally and locally how we interact primarily with people coming out of incarceration. So, I feel like they didn't, in the slides, there's a lot of assumption that you all know what we do. We provide sober activities for people in recovery from substance use disorder. And through our app New Form, there's recovery services available on New Form. They can access Serenity Recovery Connections. They can access our programs. They can get all kinds of different services that are available to them, as well as our weekly programs. So we have that. We have a wraparound service for people that are incarcerated from probation, parole, and out. So we provide programming behind the wall on a tablet system, virtual programming when they get out, or when they're probation or parole, they're welcome to come to our programming. We have specialized volunteers that we're trained to meet them and take them to their first event and kind of help make that transition more comfortable, or, just we call it the 5,000-pound board. Sometimes you can imagine walking into your first workout class, it can be hard. You're brand new in recovery and you're trying to go work out. That can be really, really hard. So we just provide somebody who will be like their first workout and help them transition into it. So, and I cannot read that from here, so I'm going to. So we've been in Colorado Springs since 2010, serving the community. As part of the funds that you gave us, $500,000, you said we would serve 2,500 residents through in-person and virtual programming. We would host an average of 23 events per week, over 1,000 of them annually, including climbing, yoga, CrossFit, and more. We would recruit and train 30 new volunteers to lead programming, onboard 10 local organizations onto the new format, including 5 with criminal legal service realm, and support over 100 people that are justice involved individuals through reentry services and recovery connections via partnerships with corrections, parole, and drug court system. So our progress so far, the first deliverable of reaching 25 unique individuals with our programming. We're about 60% of the way there. We've served 1,492. Over 1,000 of those are brand new to the Phoenix. Training and recruiting 30 new volunteers. We got 18 new volunteers. We just did our first guide training. That's a pilot program to introduce these people to Phoenix that can have incarceration, probation, or parole. We just did our first training on Saturday, and I got the opportunity to be a guide for my first individual. He was incarcerated for 21 years, when he was 14 years old in Virginia. Behaved so poorly that they sent him to Colorado and is now paroling in Colorado Springs. He had not been, he was 14 days released. He came to our roaming program, super pumped, excited. We got the opportunity to take him to the first restaurant after the road since he was 14 years old. Talk him through how to tip, that kind of thing. So it's a lot more than just a workout. Now there's not everybody on parole wants to be on parole and wants to do well, but now he's got a community of people who have been on parole before and can show him the way that do want to do well. So that's kind of the power of the guide program. We offer an average of 20 events per week. Right now we're doing 34, so we're at 170% of that goal. Onboard 10 new organizations to new 4 and 5, which would be CLS orgs. We have 32 orgs on there, so we're at 330% of that goal. And Springs Recovery Connections is one of those. Like I said before, one of the things that we do is we send the programs into the prison so you can watch us on our tablets. And we had a really awesome experience where an individual that was incarcerated watched our programs while incarcerated. When he got out, wanted to find the Phoenix right away. He's been part of the Phoenix for a while, and now he's actually coaching those programs that are virtually sent in. And we have a short video of. So that's a little snippet of what we do. Then the last slide is actually kind of the call to action to our constituents. Contact information on how to reach out to new. Any questions for them?
Thank you, and I'm so glad we didn't have to work out because I hate burpees.
Worst.
Thank you so much.
Thank you.
No, see, everybody hates burpees, not just me. I just want to say it first.
We ban burpees.
Thank you so much.
Thank you.
Before we move to public comment, we do have a report out from One Chance to Grow Up, and I believe a video.
Opportunity to present, just doing a very brief, general overview of what we've been up to in the last month and what we have looking forward to this summer. Our written report will be submitted on June 30th, which will include metrics from pre and post assessments of how well we're educating on the harms of marijuana and its connection to opioid use. And what we have really been working on is partnering with school resource officers. Last week, we just had our third presentation in the last 6 months to train them on everything related to the harms of high potency THC to the developing brain and everything, a lot of scientifically backed studies and research, and as well as my family's personal story. We're doing a 3-part webinar series this summer. We did our first webinar yesterday it was called THC 101. And I will share a link to that in a follow-up email with you all tomorrow. The second webinar is going to be in July, and it will feature a medical expert, Libby Stout. And the third in August will feature impacted parents, stories from impacted parents. Just wanted to say in the last month, we presented and we were a vendor at the Colorado Association School Resource Officers. We did an SRO training last week, as I said, which was our third this year, in conjunction with the El Paso County Sheriff's Office. And tomorrow we're doing a lunch and learn with Fostering Hope. They support foster parents and harm reduction, and so we'll be partnering with them. One of the goals is to create content. We obtained several videos from the CASRO conference of school resource officers, just sharing little snippets about their personal experience. And one of those videos I would like to show you in just a moment. But this message is reiterated by every single school resource officer who we interacted with. It is a massive problem in the schools. And so while our presentation is a little bit like preaching to the choir to them, but we do offer support materials like educational posters, handouts, stickers, marijuana-free zone stickers. We're really working to support them so that they can educate trusted adults and parents, and of course, the students. And so we exceeded our goal of 8 in-person events. I think it was back in March. We're now past 15. And we have at least that many more scheduled between now and the end of the year. So I'm very busy, which is a good thing. And yeah, do you have any questions? Just wanted to say thank you for the funding, and I think it's definitely helping, I hope educate the youth and parents of our community. It's very, very important. Thank you.
Thanks for your updates. Moving on to public comment. Do we have any? Oh, we do.
Just one, Sam Wilson with the Full Circle program.
Sure.
My name is Sam Wilson. I am the Regional Program Director for the Full Circle program in Central Colorado. You guys have seen, some of you probably remember me from a couple of years ago. Ben and I were coming up pretty regularly and probably during public comment. Ben is currently in Sweden doing a retreat with young people in Europe. We're in early recovery. But I just wanted to come up here and say a couple of things. So number one, thank you all so much for your funding and support thus far. The Colorado Springs Full Circle program is up and running and doing amazing work. Our intent is to, in this next funding cycle, apply for $239,950 for staff salaries, assessment and data management, our internship program, and continued occupancy costs in our facility up here, which is absolutely beautiful if you haven't seen it. And then beyond that, one of the challenges that we've faced so far is basically supporting young people who are in treatment programs and actively participating in Full Circle. We have a preferred treatment provider that operates out of Centennial called the Cornerstone program. And what they do and what we do fit together like a glove. Their modality is the same. Their philosophy and approach is largely the same. And those are the best outcomes that we've seen in terms of the young people that we've worked with. So, Full Circle combined with IOP at Cornerstone just tends to yield some pretty incredible results. So, we're thinking about, now they're a separate entity from us, but we're wanting to look at supporting them and potentially opening a location in Colorado Springs, or alternatively, looking at finding some funding for transportation for young people who are involved in that program to actually be able to go up to Centennial for treatment and continue to participate in Full Circle. So you may end up seeing a request for some funding along those lines, but I also just wanted to ask if anybody had ideas about who we should talk to or places that we should look to support that cause. Because ultimately, if we can get a program like that to work with teenagers out here, and I just think we see more youth in recovery on this side of the state. So if anybody has ideas or thoughts about that, please let me know. And the very last thing is, this is a little bit ridiculous. So I was late today because I went to the old building where these meetings were held. And then not only did that happen, but we have these flyers for this community event that we're going to do. And I want to invite all you guys to it, but just to give some context. So I go through the metal detector at the other building, put my flyers in the bin next to my coffee. Security guard moves the bin. And so we have these, slightly flyers for you guys, but
Color accent is what you call that.
Yeah.
Coffee colored accent.
Yeah, exactly.
It wasn't an accident.
You can smell it. It's great. But July 10th at 3:00 at the Colorado Springs Full Circle office, we are doing this event for the entire community, and we want all of you to be there. The event is water balloon volleyball.
Wow.
Oh, yeah. Which is exactly as amazing as this sounds. And look, Yeah, wear a bathing, you know, whatever, like, but yeah, please come be a part of that if you can. It's gonna be a ton of fun. You can actually see the Full Circle office firsthand. And if you don't wanna, you know, throw water balloons at people, I don't understand why you miss an opportunity like that, but you don't have to, obviously, see it. So that's gonna be pretty great. And please, if you want one of these beauties, come see me after. Also, Friends is spelled wrong on here. Other than that, though, it's legit. So
Thank you.
that's all I got. Thank you.
That is the only one we have signed up for public comment. There are no other.
I just wanted to talk through a few things before Michael quickly makes a motion to adjourn.
Jake. It's Mike's making it.
Still, you know, we can still do it.
Yeah,
And then
that's
if,
right.
because we're adjourned.
Okay, let's go. Before the help comes, let's go. We want to deal.
So I just put together briefly a bulleted list of kind of what I see the next, or the rest of the year looking like. July 1, the new grant application cycle opens. I was proposing canceling our July meeting. We don't have any decisions that need to be made. Their summer schedule is already pretty wild with different conferences and taking some time off. And so if I don't hear any, I really want to be here in July, I'll go ahead and cancel that meeting.
Sounds like a consensus.
That sounds like a motion.
Yeah, and I don't think we actually.
Kenny, I'm joking.
Yeah,
You always get after me.
In August, I'll provide another opportunity for current recipients to come back and give some report outs ahead of the September 1 closure of the current grant application cycle. And then we'll also have a report out from our non-voting subcommittee. They'll report out and have some recommendations on the structure of that of the non-voting members.
Can I just ask, who is the non-voting subcommittee at this point?
So I'm chair of it. There's a group of about 6. I think they're listed on there. They received an email with some suggested dates and times. So if you haven't responded to that, please do. I responded today. And it's just a kind of review. We've got some people who were non-voting members that haven't been here a long time. We just look at that, but then also look at requests. We did have a recent request for somebody who would like to get involved. So
yeah, so the current council members are Mr. Deisler, Commissioner Stone is the chair, Commissioner Geithner, Mr. Michael Allen, and that is it that's left currently on the council. There were a few members who are no longer on council.
Okay, they were on the subcommittee. I was gonna say, I was like, I'm pretty sure it's on the subcommittee, but I didn't remember receiving anything that we were meeting, so I guess I need to.
She's probably working with Paula or.
Okay.
It's taking some time to get there.
Okay.
Yeah.
So what is?
We're
this
behind a little.
I haven't seen one either. They look at our non-voting members like Mr. Bronsky, Matt, I'm messing up his last name.
Riviere.
Yeah, Riviere. Thank you.
Yeah, we put it on this months ago. It's just taken us a while to get there.
Yeah, okay, I was
Exactly
thinking,
what they.
No, that's fine. It's just taken us a while, so I'm sure it's.
Yeah, it allows us to have even, more voices on the table that are, outside, elected in service, so that we can make good decisions.
Okay. They're just not voting representing.
You're just not.
They're just not voting.
Right.
Full participants, but not voting.
Okay, good.
September 1, the grant application closes. September is when I identified a good time to have a strategic discussion about our regional data and evaluation framework update and kind of where that data subcommittee is, and those challenges and opportunities. October is the meeting where we will do funding recommendations and awards for that July through September cycle. And so that'll be well, it depends on how quickly we get through that meeting, but it could be a full meeting or not. Depending on how many applications we receive, but I've reserved the entire meeting just for those funding recommendations and awards. And then November, a strategic review of kind of where we've been this year, what we've done, and identifying some 2027 priorities. So looking at all of the outcomes across funded programs for 26, our progress towards the strategic plans goals, and then our funding distribution by pillar. So you all can see the efforts that we've made in kind of redistributing those funding buckets. And then I proposed canceling our December meeting. We have canceled that December meeting, I think, every year that the council's been in existence. So it'd just be nice to get it off calendar now so you all can grab your time.
Can you just make sure you get July and December off of our calendars
Yes,
now? So that we know.
Yep. Okay, unless Jake wants to meet for Christmas.
No.
All right.
Motion to adjourn.
Yes.
We're adjourned. Thank you.
Thank you.
Yeah.
Parking lots.
Wastewater plant again, was, for the CEC.